Hi everyone, today we are going to be talking about the HPV virus and the vaccine. Actually, I was requested to do this interview by colleagues because there are some communities in which the uptake of the vaccine is quite low, and this is of concern. So the goal of this interview is to provide clear and reliable information to families so that they can make informed decision about whether the vaccine is given to their children. Joining me today is Professor Margaret Stanley. Professor Stanley is a professor of virology and epithelial biology. She is internationally recognized for her work on the papilloma virus and on vaccines. So there is no one better to have this conversation with me today. Margaret, welcome. Thank you so much for joining me today.
It's an absolute pleasure.
So, Margaret, as you know, this podcast is aimed at educating the public. So we try to avoid using medical terminology as far as possible so it remains accessible to everyone. So let's start. Can you tell us a little bit about the HPV virus?
Well, human papilloma viruses are members of a huge family. And like every family, they've got good boys and bad boys, or good people. Let's not be sexist here. And the good people live perfectly reasonable lives, doing their thing, not causing trouble, no problems with the authorities. Whereas the bad guys go off the rails. And it's the bad guys going off the rails that are the subject of today's discussion, because at the end of the day, they cause cancer, where the good guys simply cause little warts, either on your skin or inner coverings. The bad boys cause cancer at these sites, and that's the problem. Now, it's great in some ways, because when you have a virus, you've got the possibility of developing a vaccine which prevents infection. So if you don't have the virus, you don't get the disease. And that's really what we're all about.
Okay, thank you. That's a really, really good analogy to make it clear about the HPV virus. And tell me, how is the virus transmitted?
It's transmitted by an infected piece of skin rubbing against an uninfected piece of skin. Now, the bad boys that we're talking about, the skin is genital skin. It's what women always call down below. And so it's a sexually transmitted infection, and we can't get away from that. But I would remind you, as a gynecologist and obstetrician, pregnancy is a sexually transmitted infection. And the infection from papilloma virus is 80% of us, 80 out of 100, throughout our lifetime, will either be infected, becoming infected, or have been infected. So this is not something which only involves the selected few. It's common. But as I say, it's skin against skin. And I'd like to really make it clear now that it could be in the genital tract down below. It can be any skin. So it could be on your vulva, it could be in your vagina, it could be on your cervix, it could be around the back passage. So it's got a wide spectrum. Now, so you don't need full intercourse, full penetrative intercourse to become infected by HPV. So when we talk about it, we should remember that.
Okay. And that is a startling figure, actually. 80% of women will be affected at some point in their lives.
Men.
And men, absolutely. So this has...
As I keep saying to people, it takes two to tango. So
Indeed.
it's exchange.
So this has enormous public health ramifications. You know, it
Exactly.
affects entire populations, isn't it? Pretty much.
Well, if in the UK and everywhere we've got enough money to have a good screening program, cervix cancer is being controlled to a large extent, principally in women over 30, but under 30 you're at big risk. But if you live in a poor country with not much infrastructure, not much money to spend on screening or anything else, then this is probably the commonest cancer women will get. So, and it's certainly the one they'll die from. And they'll get it when they're most productive
Yeah.
in their 40s. And women are the engine of societies, especially in poor societies. They look after the old. Of course, they have the children. They look after their children. And they frequently get out there and work and support the family. So they are essential. And to lose one, to lose a mother, is the most awful thing. And that's why I'm very passionate about the vaccines
Yeah.
and their potential. They are
Absolutely.
for women. They
Absolutely.
may
And,
be
and,
for
and
women, but actually we give them to the girl to protect the woman she will be.
yeah, it's very. I mean, I'm really passionate as well about particularly. I mean, along the same vein, smear tests and women getting smear tests, because I explain to patients smear tests. We're not doing it to pick up the cancer. We're doing it to pick up changes before they become cancer, and it's one of the very few cancers that we can actually prevent. So this is even a step before prevention by smear test to prevent infection with with the virus in the first place. So tell me, can you just detail what problems? So you mentioned cancer. What problems the HPV virus can cause, and what problems the vaccine is looking to avoid or decrease the risk of?
Well, it's certainly its main objective is to prevent the cancer that because you're going to die from that.
Yeah,
But it also will prevent the precancers, which the smear test is designed to find. And if you, the smear tests are not just there to say you got the precancer. They're there to say, go and see Dr. Busby and she will remove it. But it's a surgical intervention. So the vaccine actually prevents the precancer, prevents the cancer, and crucially prevents infection. Now, vaccines don't always prevent infection. The COVID vaccines make sure you don't die, but they don't prevent infection. The HPV vaccine prevents infection and it prevents any disease coming from it. Now, I said there were good guys who cause warts. Well, they cause genital warts as well. These are different members of the family to the cancer-causing viruses. And they may not kill you, but they're very unsightly and
yeah,
patients get
very unpleasant.
extremely unhappy. So they prevent those almost totally. In Australia, which started its vaccine program back in 2008, you hardly ever see a genital wart in a clinic. And the old days where you could hear cryotherapy going on disappeared.
Yes.
It's very quiet.
Gosh, that's great. That's so brilliant. Absolutely. And just to say that Dr. Busby doesn't do colposcopy, so you won't be sent to Dr. Busby. But yes, you will indeed be sent to a gynecologist who does colposcopy and will biopsy and do the necessary treatment if you do have precancerous cells on your cervix.
I also
So
want to say this, that the vaccine actually does prevent cancer
yeah,
because we've got the information now from Scotland and from England. And remember, we started our vaccine program back in 2008. And in all those women coming up for smears, if they were vaccinated in 2008 when they were 12 or 13, in Scotland, not one of them had a cervix cancer
that's
in the 25 to 30 age group. And
Wow.
you will know that actually it's not uncommon in that age group.
Oh,
It's
yeah.
completely eliminated. And the same
That's
for England, the same for Sweden, which also did the same thing. And even the USA, which has had a very variable program, it's shown a big reduction. So works.
yeah, 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 yeah. Okay. And so can you tell us how the vaccine works? There is some reluctance in some communities, as I mentioned at the start, to get the vaccine. Tell me how the vaccine works.
Right.
And can you tell me of any risks that may be involved? Because people may be worried about this.
Well, to go back to the virus, if you look at the virus under the highest possible microscopy, it's a little ball, and it's really just like a plum, I guess.
Okay.
So it's got a cover, and it's got an inside, and the cover has two proteins, and one of those proteins is recognized by your immune system, your defense system. And so, if that and it the immune system, if it recognizes it, makes a good defense of antibodies, and antibodies are um, really soldiers in your bloodstream. And if they detect what they've been trained, they're all trained to say, something nasty, they bind to it and remove it. So the trick with the vaccines is to just get the skin of the plum and just get the one protein the immune system sees and present it in almost the same way as the virus does. And we call these virus-like particles because they look just like the virus, but they don't have the DNA that makes this virus do bad things to you. So these are what we call in the trade subunit protein vaccines. And they have the HPV vaccine has a tremendous safety record. Uh, you know, it's getting on to almost 1 billion people, I think, have had the vaccine in one form or another since it was registered and licensed. And there are no serious side effects associated with it, despite what you might read on the internet. There are no serious side effects. People often say to me, what are the side effects of the HPV vaccine? And I'm quite blunt. It's a sore arm.
Yeah, that's it.
But you have to realize that the side effect of cervix cancer is death.
It's
So
horrible.
make a choice. Make a choice.
Treatment isn't pleasant either. Even
With the best intentions, it's rugged to go through. So
so.
for me, this is no brainer. Now,
Okay.
people do get worried, and parents get worried because their kids are well. They're not engaging in sex at the age of 12, 13. At least we hope they're not. So why on earth should you bother? Well, it's what I said. You're protecting your daughter when you give her this vaccine. You're protecting your son when you give him the vaccine at the age of 12 or 13 because uh, the protection is for when they become men and women, when they start to lead the lives that all of us lead. They're protected against infection with this virus because they had something when they were an adolescent.
Yeah. And can you tell us what the schedule for the vaccination program is? How many doses? How far apart?
That's all changed over years. We started off with 3 doses over
Yeah.
a 6-month period. Then in 2014, the World Health Organization said, actually, you can get away, if you're giving it to girls and boys under 15, you can get away with 2. And I've been part of the more recent work, which says actually you can get away with one dose. So one dose, and that's what we do in the UK now. The JCVI, excuse me, made the recommendation, and that's now what the immunisation schedule is. So your daughter or son is going to school. When the immunisers come in, it's that one time. If they're out of school, then the immunisers will make an effort to come back in the next time and immunise them. So nobody should miss the net. So it's one dose once, but it must be when you're young. It must be under the age of 15. Must.
And this one dose we think will provide lifelong immunity?
Well, it's looking that way. I mean, this was, I wouldn't say serendipity, but it was actually a big trial in India, which was trying to show, it was a WHO trial, show that 2 doses was as good as 3, because when you change your schedule, you want to be pretty sure. And for all sorts of reasons, all trials for HPV were stopped in India. And but they were stopped from getting the vaccine, but they were not stopped from being followed up by the trial team, the doctors and nurses, to make sure they were all right. So they were actually getting smears and being looked after properly. And to everybody's amazement, they naturally fell into 3 groups. There were girls who'd had the full 3 courses, girls who'd had 2, and girls who'd had 1. And there was no difference. No difference in the prevention of infection between 1, 2, and 3. Now, epidemiologists, of whom I am not one, have very, very strict criteria for clinical trials that show any evidence. And this was what they call an observational trial, not a randomized controlled trial. What that basically means is you've got a risk for bias. That's, these strict trials have to be just so. So they needed a randomized controlled trial, and there was one done in Kenya. And this was a very, very good place to do it, because Kenya has one of the highest rates of infection and cancer in the world. East Africa, I always say, is the cervix cancers, the capital of the world, although some of the Caribbean countries have come pretty close. So they did this, and they immunized girls with 1 dose and 2, 3 doses, and followed them up, and they were completely protected. So if you were vaccinated, you didn't get infected. If you weren't vaccinated, you got infected. Now, this couldn't be because many of the other people in that community were immunized or had made a natural response. So everybody was at risk of getting infected, but you were only protected if you were vaccinated. So that's had a tremendous influence. So the evidence now is from the Indian trial and one done in Costa Rica, is that the protection lasts for at least 17 to 20 years.
Okay. And tell me, you say that the best time to be immunized is under the age of 15?
Yes.
Can you explain why that is?
Well,
because I think, like you said before, some parents will think, well, I don't need to immunize my child because they're not yet sexually active. Is there another?
No, that's not quite fair. The reason why you immunize before 15 is, first of all, that the response to the vaccine, the actual defense response, the antibodies, are higher in boys and girls before puberty. It's very marked in girls, very marked in girls. So after they started to menstruate, their antibody concentration to the vaccine goes down. Not sort of to levels where it doesn't matter, but you're getting a much better response. And I'm an immunologist as well as virologist, and I've got to say the important thing about the defense response is memory. You've got to remember. Your body has to remember what this was all about, and that memory is much better if you immunize before puberty. And the other reason, particularly in girls, is that your genital system, your female reproductive system, is being remodeled,
Yep.
dramatically remodeling. You're going from a girl to a woman who can have a child, and that alters the architecture of your uterus and your cervix, and it very much alters the sorts of cells that are there at the junction between your womb and the sort of little button that's your cervix. And if those cells are very susceptible to the virus infection, so you want to protect before there's any chance that you might get infected. So this is doing the vaccination at the optimum time. That's, I want to get the very best response. I don't want to waste all my money going around immunizing. I don't want to not give the girl absolute protection. So I give it when I know I'll get the best response. And that's why.
So that I think is an absolute light bulb moment, to understand that it is given at this age because the end result is going to be optimized by giving it at that age.
Absolutely. The
And
best response.
nothing to do with sexual activity and whether it is or it isn't or whatever the case may be. This is just physiologically and biologically the best time to give that vaccine.
And, sexual activity, none of us know. It could be non-consensual. It could be, rape is not uncommon. And
That's true.
so, let's do what is the best shot.
Okay.
One shot when you're 9 to 15, perfect.
Fantastic. Okay. And you mentioned giving it to boys and girls. Is given to boys and girls. I mean, my son certainly he had 2 doses. Can you talk a little bit about bringing boys into the mix?
Yes, well, male cancer is caused certainly by the HPV virus, and they get cancer of the back passage, the anus, cancer of the penis, and cancer of the tonsil. The tonsil has a sort of epithelial or skin-like covering, and men and women get this cancer, but men, something like 3 to 4 times the incidence, the risk of getting that tonsil cancer. So men get cancer with the HPV virus. But not only that, we used to think that, not many men were infected. That's not true. It turns out that something like a third of the main population is carrying the HPV virus on their penis. So they're there as a risk. So immunizing them prevents them being infected and prevents them transmitting, and it prevents them getting the cancers of the throat and the back passage and the penis that they would get without the immunization, because they make lousy defense responses. And this is something I think I really have to tell people, that in a natural infection, it takes a long time for the immune system to see the virus because it's stuck in the skin.
Yes.
Whereas when I give a vaccine, I go into the muscle, and the vaccine goes very quickly to the lymph nodes, which are the place where all these defense responses will occur, and they really kickstart. So I get a much, much better response to the vaccine than I do to the natural infection. And men, for reasons I don't understand, make a lousy immune response. Only about 10 to 15% of them with a natural infection make antibody, whereas 100% of them do after the vaccine.
Of the vaccine.
So what I'm doing when I immunize men is blocking transmission between the man and his partner, whoever that partner is. And I'm preventing cancer in that man. So I had my grandson immunized. I stamped my little foot and said, immunize him. And he was 11.
Right. Okay. Okay. And I mean, I'm harping on about this a little bit because I think that there are barriers to accessing healthcare, and one of it is lack of information, education, understanding around certain concepts, illnesses, treatments, etc. Can you tell me, is there any evidence that being given the HPV vaccine makes sexual debut or age at first sexual intercourse any sooner than if a certain population had not been vaccinated?
No, the evidence is, it's very difficult to get this evidence, from questionnaires and what have you. But all the evidence from places that have done very good and very big studies, I'm thinking of Denmark in particular, and parts of the US. So the evidence is that actually the vaccinated girls make their debut at the same time or slightly later.
Okay.
So it doesn't change behavior, and that's what the parent is worried about.
Yes.
It doesn't. They don't all rush out there thinking, fine, I'm not going to get HPV, because HPV doesn't register on their radar. The vaccine doesn't prevent you getting the other more serious sexually transmitted infections.
Absolutely.
And condom use is not a magic protector for HPV, because the skin around the various, the back passage into the vagina is likely to be infected. A condom won't stop that. So parents really, this is the one thing they don't need to worry about. Their child is not going to turn into a promiscuous girl. Parents don't worry so much about their sons, but they do worry about their daughters.
Yeah. Okay, so thank you so much for those really clear answers. I'm hoping that this podcast and this interview will be seen worldwide and therefore give us the opportunity to educate parents, carers, families around the HPV vaccine. What would you like to say to parents, carers, families who are considering getting their children immunized against HPV?
I'd say don't hesitate. There are three things that that you have to ask when you're thinking about a vaccine. Do I need it? Does it work? Is it safe? And the answer to each of those is yes, it really does work. If you give it at the right time, you prevent cervix cancer, and you will probably prevent all these other cancers because you prevent infection. So it works and it's safe. Okay. Despite what you might read on social media, it's safe.
Absolutely, and that is one of my biggest motivations for doing this podcast and interviewing experts, international experts like yourself, to give clear, reliable, honest information, unbiased information to the public. It just remains, Margaret, for me to thank you. I can't tell you how honored I feel that you accepted my invitation onto the show. Thank you for giving such clear information about HPV and the HPV vaccine. And thank you for your sterling work in this area to produce this amazing vaccine that really, really decreases the risk, almost eliminates maybe the risk of cervical cancer. Thank you so much for joining me today.
Thank you. It's been a pleasure talking to you.